All right, welcome to part 2 of Brain Dump. If you're new here, I put a bunch of GI liver diagnoses in this coffee mug. I randomly will pull one out and then just kind of dump everything in my brain that I can think of that I think you would want to know without any sort of preparation. Yesterday's was pretty easy. Let's see what we get today. All right. And the winner is CHS. So CHS stands for Cannabinoid Induced Hyperemesis Syndrome. Basically, this is a bizarre syndrome that we are really not entirely sure as to why it's happening or what dictates who's going to be reactive to it. But basically what it is some sort of cannabis use. So whether that's from this or from, ingesting it in any sort of form, patients can have basically this immense nausea, vomiting. It's what we call like intractable, which basically just means like they can't get it to stop. And they basically purge everything out. It's very, very bizarre in that it seems to be completely random. I will say that there's a lot of research going into it, so we will probably get more answers in the future, but this is one of those things that we truly are kind of like, we don't fully understand why it's happening. And it can happen at any point. So I've had patients that have been using that for decades and they've never had an issue. And then all of a sudden something switches and they are constantly in the ER. They're requiring IV fluids a lot. And unfortunately, these patients can, there's a lot to it, but these patients can kind of get written off. And some patients that don't actually have CHS get written off as having that, which is one of my biggest pet peeves. I understand that, somebody comes to the ER multiple times a month and they admit to using, then having that conversation for sure and just saying like, hey, there's not really much that we can do to kind of get this to stop. But not everyone that has nausea and vomiting that shows up in the ER is because of cannabinoid-induced hyperemesis. And even if they use cannabis, that doesn't mean that that's always the thing that's causing it. So I've had patients that have used for decades, been totally fine, and then something switches. I've had patients where they try it for the very first time and it happens and it won't go away. It doesn't seem to be tied to a specific strain. It doesn't seem to be tied to like a type of ingestion. And really as of right now, there's really no way to make it go away other than to stop using. And this is something that patients, again, because so many people get written off, a lot of people come and they say like, hey, it's definitely not this. I've stopped for this amount of time, or, too many providers basically just say like, oh, this is what it is, without actually doing a workup, without actually looking for other causes for their nausea and vomiting, which infuriates me. But in terms of treatment, these patients oftentimes will go to the ER because they can't keep anything down and they start to get really dehydrated. Sometimes IV antiemetics or anti-nausea medications can help, but honestly, a lot of the time these patients are even struggling to get relief from that. The most bizarre thing about all of this, in my personal opinion, is this, that these patients tend to get relief if they take a hot shower. I don't understand why. Maybe in the future we will have a better understanding as to why that happens, but for whatever reason, they will come in and they say, the only time I get relief is if I take a hot shower and I'm just burning through my hot water like constantly. I'm standing in the shower for like hours because that's the only time I get relief. Or, we'll have parents that come in and they say like, yeah, he takes a lot of really hot showers and he'll stay in there, for a long time. It's kind of like the only thing that they can do at home that kind of makes it go away. And like I said, it's all about having an honest conversation. And I'm really honest with my patients and I say, look, I can't guarantee you that this is the cause, but I also can't guarantee you that it's not the cause. So what I'm going to do is I'm going to look into everything, make sure that we're not missing anything else. Do you have gastritis? Do you have reflux? Do you have some sort of a food sensitivity? Is this a medication side effect? We're going to look into all of these things. Do you potentially have gastroparesis? But I need you to know that if we get to the end of the line where we have been able to rule out all of these different things, then this very well could be the thing that is triggering it. And the only way that we're going to know that is for you to stop. And it's not something as simple as stopping for a couple of weeks or even a month or two. It can take a while for that to fully get out of the system. And patients sometimes struggle because, they'll say like, but this is the only thing that actually makes me feel less nauseous. And that's tough, but I usually kind of communicate it this way. Somebody that drinks a significant amount of alcohol every day, if they don't drink, they're going to start to have symptoms. And if they start drinking, those symptoms go away. It's similar-ish sort of thing. Your body gets so used to having that if it kind of is a temporary band-aid that makes the symptoms go away, but then you're right back where you started. So overall, a very tough situation, but it doesn't have to be, right? I think developing the relationship between provider and patient, between the clinician and the person sitting in front of them, you have to develop that trust so that you can, at the end of the process, say, hey, I need you to trust me that I have looked at all of these other things. It is not these things that are causing it. And this is really the only thing that I can recommend that we try at this point. Because ultimately we know that it affects the GI tract one way or another, right? People get the munchies. So in some people, they get the munchies, and other people, they get really nauseous. We know that the effects on the GI system are very strong. And so just trying to help people understand that and coming at them in a 1000% non-judgmental way has been my kind of the way that I find is most successful in talking to these people. I hope that helps. Let me know if you guys have any questions in the comments.